Okay, so next question. Is seeing a hygienist really that much different than seeing a dentist for teeth cleaning? So perhaps we should explain what a hygienist is first, and then we can talk about the difference between the experience that you might get or the service, or if there is one.
Yeah, so a hygienist is also another dental professional. They've gone to university. They typically kind of focusing on preventative care, cleaning teeth, gum care. They've got a various bunch of other skills as well. But if we're talking about teeth cleaning specifically, like these guys, I'm very biased because I have, I've got a really strong hygienist-based practice, but they do just such a fantastic job in keeping gum health optimum, really focused on that preventative side. Dentists do the exact same thing. They can do just as good a job. I just find if I've got that one professional who is dedicated to that, I find in my practice anyway, they deliver a more comprehensive service, but that, they don't charge more. They typically take a little bit longer. So I think they're very good value. But if your dentist is doing your visits and you're getting your cleaning done, they're doing just as good a job typically as well. Yeah. Did I answer all the questions then, Bex? Or was something else?
Yeah, I think so.
Yeah.
I think it's just, we get patients come into our practice and they, we have to introduce what a hygienist is. It really hasn't been in Australia for that long, and so I think and not all practices have them. So, quite often we'll get new patients in and then they've never heard of a hygienist or oral health therapist who also can perform the same duties, but they've got extended roles where they can see kids and, and that's expanding as well, which is really exciting. But so it's like it's this whole learning thing. You think I'm just coming in for a teeth cleaning, but it really is such an involved process these days where people can learn the ins and outs of their mouth fully, what the floss tools are to get between their teeth and all about gum disease, because as we mentioned in our last conversation, just a simple checkup, the things that we can spot, like oral cancers and early signs of decay, which can save you a lot of time and money in the chair. The hygienists are all privy to that. They are just so spot on, and their skills are second to none. So I think a practice that has a hygiene department, not taking away from those that don't, but I know for us, it just shows such value to the patient where they can come in and just be real, like you said, that dedicated person that looks after them. And I think there's a lot to be said for that. We've got some dentist members on our platform who don't have a hygiene team, and they are just guns at, they've taken additional experience to make sure that they are up to the mark that they need to be, because in our industry, prevention is, I know it's like the thing that you're saying, but prevention is the best medicine. And so I think any practice that has that at the forefront, you should definitely consider them to be your dentist. So
yeah, absolutely. I think once again, dentistry is changing a little bit. A lot of people walk into a dentist and they expect, like something to be done, and otherwise they're kind of, they're not getting anything as such. What the hygienists offer, and therapists, dentists are the same as well, but they offer this service where around they're educating the patients, really focusing on that preventative care. And they can do that just because of the way the business of dentistry is. They can do that at a lower cost and provide real value around the preventative side of things as well. So sometimes dentists don't offer that. And so it just allows that business to be able to offer that really high preventative side of things as well.
Yeah, no, it's really cool. And like even now we got this, talk about technology, we just got that airflow. Is that what I don't know what the common term for that is, but it's, it's like a supercharged jet blaster that, just powers the teeth, with all the staining and everything off it. So, our hygiene team's pretty excited about that at the moment. So
biofilm therapy, the technique is, it's very, very, very cool, very gentle, very thorough. It's almost like it's like a spa kind of experience when you come and get your teeth cleaned. It reduces sensitivity down. Amazing. But that's not just hygienists offer that, so a lot of dentists have that as well.
No, that's right. And that's it. I think all those tools and practices can introduce those techniques and tools into the practice that will help the patient. So I think it's really cool.
Because in the end, I mean, we talk about affordability of dental care. Really, like the best way for a dentistry to be affordable is to react. So not to be reactive, to be proactive. And so all of these little things add to that affordability of care for us and for Australians.
Yeah, and you want to enjoy, like you said before, like a spa-like treatment. Going to the dentist, they should not be, considered, this dreary thing that you have to do every 6 months. It should be an experience, somewhere where you go and you enjoy the people that you're meeting. You get to see, basically friends and family and catch up on what's happened in the last, few months. But then the treatment that you get should feel good, so make sure you look for that.
Such a stigma around, dentistry being, a real pain, and, like there's something to be scared about. So this, I've seen this technology, I've had it on myself. It is like, it's amazing. Absolutely love it. We won't throw like trades, the brands around here. We don't want to endorse anyone at this point, Beck. No. But yeah, very cool systems. Not yet. Yeah.
No.